These are people who we are monitoring to check their temperature. And active monitoring means that somebody reaches out to them, calls them up, and asks them to report their temperature. And this is done typically twice a day.
So they're at home?
They're wherever they are. They're free to roam.
Right.
There are 3 individuals who've been quarantined, but the people who are in active monitoring are not among them.
The midterm elections were a boon to the burgeoning Ebola crisis here in America. Not that it did anything to solve the problem, it certainly took it off the front pages and out of the screaming breaking news department. But as with most things of such import, the matter did not just go away. In New York City, very quietly, there are now 357 people being monitored for signs of the virus. Good news in that a number like that might cause the panic some were fearing, but at the moment it remains a very quiet battle. Let's go ahead and welcome to MidPoint former Lieutenant Governor of the state of New York and a noted health policy expert. Betsy McCaughey joins us. And Betsy, we heard that lady say that these 357 patients are free to roam around New York City. Bad idea?
Let me point out, first of all, that monitoring for fever is insufficient to identify who might be infected with Ebola. A series of new pieces of research, very important research, published in the New England Journal of Medicine show that somewhere between 13 and 17% of people who have Ebola don't develop a fever until they're very far along in the disease. In fact, often already hospitalized with serious other signs of the disease and clearly infectious. So when she says people are being monitored twice a day for fever, be aware that that is insufficient.
So then what needs to be done? Put them all in a room, lock the door, and wait 3 weeks?
Well, look at why we have some 350 people being, quote, monitored. The fact is that if we suspended travel visas from the Ebola-infected parts of Africa, a small part of Africa, and we provided isolation facilities for the small number of people who are healthcare workers with American passports returning to our country, that would solve this problem. That would be a much more reasonable way to solve this problem.
Does it not at least show that New York, and again, New York, New Jersey, Illinois are implementing mandatory quarantines for anybody who comes from Guinea, Liberia, and Sierra Leone, where the outbreak is mostly concentrated? Doesn't it at least say that something is being done, something substantive is being done? And certainly we've learned from a lot of the mistakes that were made in the first couple of days of what happened in Dallas.
Well, it's very important to do that. But let's step back for a moment and look at the bigger picture. There have been some 20 known outbreaks of Ebola since the disease was discovered. This is the first time ever the disease has been carried out of a small part of Africa. And why has this been done, right? In the past, it wasn't a threat because it was in a small part of Africa. And, of course, we want to help the people in Africa who have been affected by it. But now it is being carried to countries, other continents that have never been endangered by this virus before. Doctors and nurses, and mostly the World Health Organization and the White House, are giving this disease, for which we have no vaccine and no cure, wings.
So I got about 90 seconds left. A letter to Congress on Thursday afternoon. The president is asking for over $6 billion in emergency appropriations for the 2015 fiscal year to develop, and this comes from the document, a comprehensive strategy to contain and end the Ebola outbreak.
Is it enough? Outrage. It is an outrage. $6.2 billion. It's 3 times the entire GDP of Liberia. It is more than we spend on cancer research. It is more than 6 times what the president is willing to spend combating hospital infections here in the U.S. that kill 75,000 Americans in hospitals every year.
What about those who would say it's better to go ahead and spend a lot more money right now to make sure that nothing happens and we don't get hit with a major outbreak?
Well, the fact is we don't have to get hit with any outbreak at all if the president did what every epidemiologist would recommend, aside from politics, and that is suspend the visas and isolate healthcare workers who return to the United States. There is no reason for us to be threatened, and both Margaret Chan and the White House want this danger, want us to feel this danger so that we will send that money to Africa.
So you're saying then that from the Obama administration, this is pretty much, in your opinion, a plot to go ahead and make sure that the money gets spent. It's not really all about public health.
That's right. Margaret Chan, the head of the World Health Organization, made it clear when she lost her temper last week. She said the reason Ebola has no cure is that it's always affected only poor African countries. So she is standing back and encouraging the spread of this disease to wealthy countries so that they will feel the danger and spend money on it.
If that is the case, it is frightening for all Americans indeed. Betsy McCaughey, it's always a pleasure to have you on the show.
Thank you.
Thanks so much. All right, short break, and we're back with another battle America has lost in Afghanistan and how our approach to this black hole of a country will change under the new Congress. Later at 34 minutes after the hour, welcome to the malware wars, Apple users, and here you thought you were going to be nice and cozy, right? It's all coming up here on MidPoint.